I don't think the average individual is going to wake up and think, what is my particle number today? I don't necessarily think we want them to. We want them to be able to go and say, I'm going to spend time with my grandkid and, be healthy enough to pick them up.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Venaire. Today I'm joined by Pranitha Patil, co-founder and COO of Function Health. In this episode, we explore Function's mission to revolutionize healthcare through comprehensive lab testing. Pranitha shares how Function makes advanced health data accessible and actionable. Plus, we discuss the company's rapid growth, recent $53 million funding round, and vision for becoming an all-in-one health platform. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Pranitha. Welcome to Fitt Insider. Thanks for joining us.
Of course. Thanks so much, Joe. It's a pleasure to be here.
Yeah, I'm excited to chat. Function has been a company that we've been following. And of course, you all are making kind of big waves and, doing great work to transform the industry and health and all those sorts of things. So for folks who aren't familiar, maybe we just start your introduction and what are you working on at Function?
Absolutely. So Function is a all-in-one health platform that we start with over 100 lab tests, offering a holistic, comprehensive view of your body. So from your heart to your hormones, to your thyroid, to toxicity, we want to give people an understanding of their body, and not just an understanding, but what to do about it after they get their results. So it's truly a revolutionary way for people to get the information that they've been looking for about their organs and their organ systems and the status of them. The goal is to establish a baseline with the list of tests that we offer and test over time so that you actually know how you're changing, because as everyone knows, our bodies are ever changing and ever evolving. And the big thing here is the annual membership is $499. That's $1.37 a day. It's less than a coffee, with the ability to get deep insights into your body and, again, be able to test that over time so you know exactly what to do, where to go to make changes.
Yeah, it's super interesting. And this idea of establishing a baseline, even people having any idea of what's going on in their body, great place to start. Thinking about the kind of landscape of at-home diagnostics, blood tests, annual physicals, for folks who are kind of deep in this world, it can feel like maybe they're inundated with like, hey, do this test, do this membership, do this, optimization. How do you think about, where Function is and how you convey that to people and then what they're actually getting?
Yes. So if you go to your annual physical today, you're getting maybe 19 to 20 biomarkers, and at most probably 30. That is honestly very dated. We should not just be getting a subset of this information. The science has improved, data has improved, and information has improved on what you can do about your body. So to start, your annual physical is just scratching the surface of what's going on with your body. And the way to think about the types of tests that are important is to get a level deeper than what our traditional physicians' practices do by looking at all the organs and organ systems. Historically, you go to the doctor when you have a symptom, and it's a sick care system, which is what we've heard often. So let's reverse that. Let's try to be proactive with how we think about our health and also how we think about health care in general. It's not meant to be reactive. It's meant to be, hey, I have a pulse on what's going on. When you go to the physicians today, oftentimes you're just reacting to the symptom, and there's usually something deeper going on. So what we like to focus on is getting to the root cause. And Function really allows you to get to the root cause, but because of the comprehensive nature of the testing we offer.
So as you're, going through that explanation, I'm nodding my head. A lot of listeners are probably nodding their head, dissatisfied with traditional healthcare, it not being proactive, certainly being reactive in terms of sick care. And I think, attacking that problem is so massive. And there's obviously a lot of different companies and approaches. How did you kind of arrive at like, okay, we're going to start with this testing, do the panels, do it more in depth, and that actually going from like idea to like, okay, we can build a company around this and actually get it launched and gain some traction?
Absolutely. To start, it's good to know that about 70% of medical decisions are based off of lab testing. So when I met my co-founders, specifically, I met Jonathan, the CEO. I am a Function member, first and foremost. I was basically doing what Function does on a spreadsheet on my own in my 20s. My personal story is that I had prediabetes, I have PCOS, and I had very high cholesterol. I was tossed around the medical system with prescription to prescription and essentially figured out that that wasn't going to be the solution. I needed to run experiments on myself to find the solution because I was 20 and nobody was going to prescribe me a statin, as they should not have. And so because of that, when I met Jonathan and Mark and Mike, our the co-founding team, we decided we have to figure out a way that we start with the thing that tells the truth, which is the data. Let's start with something that isn't symptoms. It's not just, I have a stomach ache. Okay, let's start with the data. Let's really get to understand what's going on and then make decisions based on that, because that is how the system should work. We should really get a sense of our biology and then be able to make decisions from there, because that is what physicians are taught to do. The goal, though, is to not just rely on your doctor, because you deserve to have this information about your health. It shouldn't be hidden behind any sort of door, because the science is here and the data is here.
There's this layer one, which is, wearables and all the devices, and you're getting this kind of insight into your health, just what's happening in your body. And then there's, okay, maybe I can do a diagnostic test and get a lab kit mailed to me. And, I start to figure out some things, but certainly not to the level of blood biomarkers and where I'm able to, those are wellness exams, right? They're not medical products, and you're not able to make any type of diagnosis based on that. But even getting a lab test is ahead. Like, why is it so difficult, and why did we even need this layer of like, hey, yeah, I can just tap Function and go get a blood test?
Yeah. So I think it comes down to how the system was built many years ago, with the incentive structure with physicians, hospital systems, and payers. The system is built so that physicians can take care of sick patients. I have all the respect for the medical system. It has worked for folks who need care. It has not necessarily worked for those who are looking for proactive, preventative support. That's just the way it has been. So companies like Function have to come in and shake things up a little bit. We have to obviously work with the existing players, and we do. And that's the reason. Is it's just has never been, let's get a scan of everything that's going on in your body for all, US citizens, and approach health from that angle. It has been reactive, and that's just what has to change. I think that's a fundamental question as to why we're doing what we're doing, is because so many of us have had life experiences that you're just sitting there and you're shocked. You're like, why did I have to go through that? The fact that we have all our financial data at our fingertips in real time, and we don't have that with our health data, is, in my opinion, shocking. I would prefer to have both, and I should have both. So I just fundamentally think it's the way the system was built many, many years ago.
So you kind of start at this first principles place of like, okay, let's get the data labs that enables us to make these decisions, the majority of medical decisions. And then there's all of the things, like what comes next. And like, so now we have this information. I know what the kind of data says, and then how do I live a healthier lifestyle? Is there something wrong? How do I continue to improve over time? And as you say, like, establish this baseline, then check against it. What does, I guess, that experience part of the platform look like?
Yeah, great question. So I'll just take you through the process. You sign up for a Function membership. You go get your labs done at one of our 2,000 locations across the country with our lab partner. It's really simple, 15-minute visit. You're in and you're out. And then about 2 weeks later, you start to get populated results right away. But about 2 weeks later, you get the full set of results. And then you also get a clinician's review, a summary of what's going on. The platform is beautiful. It's designed to give you as deep of information and then as high level, summary level information for you to start to digest what's going on. So by organ system, we have all of the biomarkers you got tested. And within each biomarker, we have, what the biomarker is, what foods you might start to eat, what supplements you might consider, what foods you should limit, references for all that material. That's biomarker by biomarker if you're really looking to dive deep. And then on top of that, you have your clinician summary by organ system, as well as an action plan for you to actually take the next steps for foods, supplements, exercise, things like that. Funny enough, as most of us probably know, lots of these solutions are lifestyle modifications. And then there's obviously the folks who do need a medical intervention, and you do need to speak with a doctor to get a solution there. But it's not rocket science. I think the biggest thing often comes down to behavior change. And what we've learned is testing over time and making those changes and seeing those improvements are so helpful for motivation. Take myself, like my vitamin D when I first started Function was way out of range. Such a simple fix for something like vitamin D. Start supplementing. I see that improve. I'm motivated then to be like, okay, what else? What else can I fix? Even if it takes a long time, like I mentioned, I have high cholesterol. That one's going to be with me for a long time genetically, but what I'm looking forward to seeing is that number going down over time because I'm taking actions in my life to make sure that that happens. And I've heard stories like this across the board from our member base. Is that's super helpful, is taking the action that we let you know to take and then getting tested again to say, this is actually working for me versus being in the dark, which is, I think, what often people feel is, oh, it's just a feeling. I feel better, but let's actually get under the hood and see what's happening.
Yeah, it's huge to actually know what's going on and have some type of feel like you have agency to like, oh, now I can improve this, I can change it, I'm making progress, and then retest against that. When you think about, having the ability to get a blood test, enabling that through Function, getting these results, people are making these modifications over time. Obviously, you're collecting a ton of data. There's already people who are, you know, they can use other kind of platforms or avenues to get blood tests. What gets layered on as you think about, okay, this is how we make progress down this like preventative, proactive like solution for health and healthcare?
Yeah. I think you're going to know this answer, but this is like such an important question because we believe fundamentally that diagnostics is the first layer of data. It gets us to this understanding of what's going on in your biology, but there's so many other incredible data points that you can layer on top of it to get even more personalized. Think wearables, think self-reported data, think past medical records. How can we start to build a story that is deeply personal, that takes into account things that have never really been mapped together for you? That's our goal, is build a data set and a story for you as an individual so that you can get as personalized care as possible. Um, no one's really doing that today. When you go to your doctor, good luck with even having your last set of medical records in hand and having that been reviewed. But if you think about this, the goal is to have a complete picture and then start to layer on. For example, if you want to go see a cardiologist, we have a summary for you on what's going on with your health, also how it relates to your Aura Ring data and your Peloton data, as well as your past medical records, how you've changed over time. So it's now longitudinal. And there are more frequent data points. It's not just 2 times a year of testing. It's way more if you're wearing a wearable or you're self-reporting your data. And we're then giving a summary to you, to your cardiologist, so that you all can make a plan together. That's just one simple example of how we envision Function being an advocate for you as an individual Function member.
Yeah, I think that's like you're talking about, hey, I was doing this myself. I had a spreadsheet. I was tracking all these things. Like, yeah, put me in that same category. And I think
Yeah.
it's been awesome, call it over the last really 5 years, but maybe decade for that to shift a little bit where it's like, okay, platform X is doing this piece and wearable Y is doing that piece. And but still at the end of it, feeling like I have to put all these pieces together and like try to make sense of it, like you said, with this integrating other, you know, data sources and being able to share that information. I feel like then you get to this like kind of fundamental question of, are we the hub or are we sharing this information? So is my function data going to be available in, other platform who's also trying to aggregate all of this? Or is that only going to flow to Function and you are trying to own that? Like, where do you stand? How do you guys think about like just this open versus closed and kind of siloed sources of like health information?
Today, we're looking to be the all-in-one health platform. So we are going to be building that for you so that it's not confusing. You're not the one taking data here and entering it. We're just trying to make it so simple for our members to become a member, add your data in as you want. It's your data ultimately at the end of the day. And so that's our goal, is to be that platform for you that's able to get all this data in one place and then be able to make actionable insights on the other side of that for our members to take action.
The Fitt Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. I feel like there's a lot of conversation around this, but not a lot of progress in terms of like breaking through. And of course, Function might be a little bit further off from this as well. But it's then like, okay, what is the AI health coach agent recommendation like that sits on top of this that can actually help me, make sense of all of this information, not just, hey, these are the lifestyle recommendations, but how are you thinking about that? What's being implemented now, or even how do you see that kind of landscape evolving?
Yeah, we're definitely going to be part of that movement. It's ever evolving. And I think we're in a space where we are absolutely going to be using tools as we see them occurring. Today, we don't use that in our system, but we absolutely think that technology is what is going to solve this problem for us. We cannot rely on, for example, 10 individual physicians to put all the pieces together for our 70,000 plus members. We do believe that the technology is the future to getting some of these connections between data points that have never really been seen before, because an individual human has only so much capacity. So I do believe that technology is going to be the thing here that unlocks the future. We're just part of that movement.
Changing gears a little bit, there's a couple other things I wanted to chat with you about. One was, you said it's the membership's $4.99, and that is, kind of a stark contrast to traditional healthcare in terms of, well, one, having no idea how much anything is, and then two, when you do find out, it's exponentially more than you could have imagined. Like, how did you arrive at this business model? How is the kind of subscription and membership working? Has it evolved over time, and do you anticipate it evolving in the future?
Yeah, great question. So, like I mentioned, we have an incredible partnership with our lab partner, and our goal is from the offset has been to make this as accessible as possible. $500 for this amount of testing. If you ask your physician and you have insurance for it, I've tried this. It's $10,000 to $15,000 for this amount of testing, which is shocking. Which is why our goal from the offset as founders was, let's make this as accessible from a price standpoint, but also from a location standpoint, which is one of the main reasons why we partnered with our labs. And that's really critical for us to keep in the future. We fundamentally believe that everybody should have access to this information on their health. So how can we get this into everyone's hands? That's our goal. And that's the standpoint we have. And it's also why geographically, where we really are everywhere. We have a footprint across 47 states, and that's been incredible because of the ability to scale with our lab partner.
How old is the company? How long have you been around, like, officially?
We founded in 2021, but we really only kicked off our beta in April of 2023. It took a while, obviously, to get everything set up with our physician partner, our lab partner, getting all the testing done. So we kicked off the beta in April of last year, and the growth has been tremendous. Like I mentioned, we have 300,000 people on a wait list and 70,000 active customers, which has proven that folks want this information.
That's what I wanted to ask about was, when I first connected with Jonathan and started to learn about Function, it was already, hey, there's X number of people on the wait list, and we're getting ready to start to, onboard people to the actual membership. What was that process like? Like, what do you attribute? One, how did you go about building this wait list and building kind of the interest even before it was launched? And then two, beyond the like, oh, people clearly want this, the demand, which is great. Was there anything tactically in terms of like building that wait list that you did or have been able to sustain? Because now there's, like you said, hundreds of thousands of people on it.
The growth has been so much of our initial growth was viral. It was mom in Kansas joined and then brought her family. And that added to our wait list. That virality really added to our wait list really quickly. And then we only did a little bit of marketing at the beginning with Dr. Mark Hyman, our chief medical officer and co-founder, with him going on podcasts and him, posting on his social channels. And the growth has truly been tremendous as far as the experience. It's just we focus so much on member experience. We also want to make sure that you're getting your result in time, and that's been critical. And we're obviously we're like 100% transparent about the pricing. And so all those factors combined being a priority for the founding team was what I think unlocked our success. Is it's so simple. We did one thing. You're getting lab testing and you're getting access to those results with clear delineation on what's going on in your body. And that's what we focused on to get to where we are. And it's just because it's one story. It's like you're joining the wait list for this one thing. And I think that's what unlocked our success early days.
Sometimes like this perception of, oh, there's a wait list and that builds interest and it feels exclusive, so people want to join it. And separately there are kind of other companies in the digital health space. Levels comes to mind, did a
Yeah.
really great job with this like wait list idea and how they've been able to do that. What is happening from like the wait list to onboarding, and what triggers that to bring people on, and maybe what's the capacity to do so?
The fundamental piece around the wait list is you are getting off the wait list today within a week or two. And the main thing there, I don't think I mentioned this. I'm the COO. So from an operational standpoint, the most important thing is that we focus on member experience and we can get to a place where we scale effectively to get folks off the wait list immediately. But today, you're not waiting too long to get off the wait list. We just are wanting to ensure that that experience for you is the same as it was when many months ago when we only had a couple hundred, 100,000 people on the wait list. So we're really, really focused on making sure that experience stays consistent and stable.
And then obviously when you have this kind of level of virality and demand and that's building, and then yes, the waitlist number is impressive, but ultimately it's like, hey, who's renewing that membership and who's sticking with it, and how are they satisfied with it? That kind of contributing to, recently the company raised the $50+ million round of funding. What was that experience like in terms of, hey, it wasn't that too long after we officially launched this thing that now we're going out and raising tens of millions of dollars, and of course in the COO role, I'm sure playing a pretty pivotal part of that.
Yeah, it was incredible. I mean, our main mission, which we also have with our investors, is getting this into millions of lives. And once we found those partners with our investors, and it was honestly so seamless, it was a no brainer for us to partner with them to get this into as many hands as possible, as efficiently and effectively as possible. And that's our goal, and it still is our goal today, is ensuring that we can get this into millions of people's hands.
And then thinking about, as the whether it's the broader just like preventative healthcare or longevity and obviously like health span, a lot of kind of interest and trends are all culminating to put companies like Function in a really great spot. How do you look at this landscape where I kind of alluded to it at the beginning, like there are a lot of different options, and sure, they're probably not like one to one, apples to apples choices between them, but for someone who's not as maybe aware of the offerings or even what they need to do from a health standpoint, like they might feel similar. How do you think about this overall movement and then continuing to like differentiate within it?
Yeah, I think it's an awesome movement. It's like so timely, especially obviously post pandemic, but just with everyone really starting to understand that they have control, maybe than in historically, it's been just a different approach. I think the most important thing here is when you're evaluating the different solutions out there, what's the most accessible, what is giving you the information you need, and then how easy is it to incorporate into your life? I don't think the average individual is going to wake up and think, what is my particle number today? I don't necessarily think we want them to. We want them to be able to go and say, I'm going to spend time with my grandkid and, be healthy enough to pick them up. And so let function do that for you. Do the crux of the work, which is making it so easy for you to understand what to do and so that you can go live your life. But you should still have the information about what's going on so that you can go live your life with confidence that things are going to be okay as you age gracefully. 60s, 70s, 80s, 90s. Let's get you to a point where you have that confidence. And I think that's the biggest piece of like motivation for so many of these companies that are popping up, including Function. We're just trying to make it so easy and seamless for folks to take control because at the end of the day, like I mentioned at the beginning, you deserve access to this information.
Yeah, thinking about maybe other platforms and even as like a user, something that would be interesting. Is it on the roadmap? Do you anticipate, people getting those results and then saying like, oh, hey, these levels of XYZ are low. You should potentially take this product, sell them that product. You should get this prescription. You should, consult with this specialist. Do you anticipate it going down that path in terms of services, or do you see it more as, you're providing all that information and then I'm just taking that to whatever clinician that I typically engage with to get whatever I might need on the back end?
Yeah, some of those things that you mentioned potentially, but right now we're focused on getting folks the data in their hands so that they can go make whatever decision. We're not necessarily going to prescribe you exactly what to do or prescribe you medication today. There is a world in which, on top of the data set, we offer, recommendations for where you might go. But today we're finding a lot of success in folks taking the information wherever they need to go on their own in their own kind of neighborhood and figuring it out for themselves.
Thinking about the level and the kind of exhaustive panel that is done, what was the decision making? I guess it's probably potentially still ongoing in terms of like, hey, what do we show people? Like, maybe all that information is there and it's my data, like you said, and I can do what I want with it and kind of dive into it. But what is the right balance of, hey, we showed them enough that this is like actionable, informative, relevant, but not too much that they look at it and go, oh man, I'm like, what am I supposed to do with all this?
Yes, I think that it was such a core part of the product building is that's why we offer up that's so much of a UX problem. That's why we offer up the information like we do, where if you want to dig deeper, you can, and you have a source of truth and function to give you credible information. But if you want the 3 bullet points and that's all, you can also just access that. But we want to be able to make sure that if folks want to dive deep, they can buy biomarker and buy organ because people have been astoundingly interested in, particularly their out of range markers to figure out what's going on. So it's our job to give them that information. And then over time, we're going to be adding, guides so that you really understand from a high level how to think about nutrition and exercise and those type of things so that you have that information again as a source of truth because as we know there's so much information out there, we're trying to keep it streamlined for folks and evidence-based as we provide this to our members.
When you're talking about healthcare, people's data, privacy, is like navigating this line between, and obviously curious to hear where you fall and how you think about it and what's kind of happening behind the scenes, but just with like wellness diagnostics and tests, it's like, okay, this isn't medical information, we're not prescribing, and then obviously some folks saying, hey, we are directly kind of trying to transform the healthcare and medical system. So that line, I guess, between like healthcare and wellness, um, how do you think about that? Where does function sit, and like how do you keep all of this very personal data secure?
Yeah. So privacy is of number one importance to us from a data perspective. So, like I mentioned, the data at the end of the day is the members' data. So they ultimately have the choice of what to do with it once it's in our system. We keep that across all from a privacy standpoint and security standpoint. We use the top tools at Function. The biggest thing here is we are not your medical provider. So at the end of the day, you can download your data from the lab and do whatever you want with it from like the PDF perspective. That's your prerogative. You can send it to your doctor, you can send it to your coach, your chef, whoever you want to send it to. We don't do that for you. And the biggest thing here is just ensuring that at any time you want to turn off access, you can. And we make that a top priority for us and for our members. And yeah, the other layer, like I mentioned, is we are not prescribing. We are not your doctor. You still have to, if you need to interact with a physician to get a prescription. And then one more layer I'll share here is physicians are in the loop across the board with Function. When you sign up, you have to have an approval from a physician to go to get your lab. And then, like I mentioned, you have a full clinical review of your results that if you do, you have that full review completed. And if you do have a critical value, which is something that's very out of range where you need like immediate care, you get a physician's phone call from us. So physicians are very much in the loop with the Function process. We're just not prescribing today.
Looking ahead, I mean, we talked about a lot, still relatively early in the journey, growing incredibly fast, improving that experience, what people are getting and what they're seeing and how they use that information, the potential for like integrations and building that kind of health data hub. What's on the roadmap? Is there anything else that you're excited about that you can share? Obviously, if you don't have to, keep whatever confidential, but anything we should look out for you're particularly excited about as you think about, we're going into Q4 and kicking off the new year. What's top of mind for you and the team?
Yeah, so many things that we've already discussed, but I think some of the most exciting things some of the things I'm most excited about are really just diving into areas that people are excited about when it comes to the action plans that we're going to have. It's not just going to be a simple 3 sub bullet point. It's going to be how is the Function a core part of your life to advocate for you, and that's the question we're looking to answer for folks so that you feel like you have answers across the board, whether you're, going to the grocery store, what kind of groceries should you be buying? You're going to the restaurant with your friends, what kind of food should you order if you just became keto? Like so many parts of your life touch health. And so how do we make that part of the decision making a little easier so that it's not just living in your head, but Function's able to advocate for you? That's the part of Function I'm super excited about for our future.
Yeah, and we'll certainly be keeping tabs on all those developments, what's next as they roll out. And I'm sure listeners, like I mentioned, nodding their head and maybe wanting to learn more. If they did, where would you point them? Where do they check out Function?
Yes. So excited to share. You can go to functionhealth.com. We do have a early access code for the first 100 listeners of the Fitt Insider podcast. It'll be Fit 100. We'll add it to the notes here. And that allows you to skip our 300,000 person waitlist and join immediately. And that is the step to join. I would say if you have any questions or anything pops up, you know my name, and our team is incredible to help problem solve and make sure that your experience is great.
Yeah, awesome. Like you said, we'll get that all linked up and really grateful for the time today and excited to share the conversation.
Thanks so much, Joe. Really appreciate the time as well.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fit.co. And one more thing, you can learn more about our recruiting and consulting services at fit.co. That's FITT.co. I'll see you here next week.